Okay, hello everyone. We have people still joining us, but we are so excited to see everyone here today to today's professional webinar, The Media, Medicine, and Mental Health. We have some exciting speakers here today, and we're looking forward to a great presentation. Before we start, I just want to note that this webinar is being recorded and will be available as an on-demand webinar within 24 hours. My name is Sasha Sicard, and I am the Education and Membership Manager here at ADAA, and I'm so excited to have our speakers here with us today. I'd like to go over a few technical details before we start today's webinar. You should see a screenshot of a screen like this on your mobile device or your computer. This is the Zoom webinar interface. You will be able to ask questions at any time during. We will collect these and answer them during the Q&A session at the end of the webinar. I would now like to introduce our wonderful presenters. We do have Dr. Shane Owens here with us today. Dr. Owens is a board-certified behavioral and cognitive psychologist who specializes in the treatment of college students, young adults, and fathers. He also wonderfully notes that he is too a dad. Welcome, Dr. Owens. We also have Daenery Pitani here with us today. She is a national correspondent with KHN, which is a nonprofit news outlet focused on health topics. Thank you so much for joining us, Daenery. And we have Dr. David Cinemo, who is a practicing clinical infectious diseases and infection control as an associate professor of medicine and pediatrics, while also serving as an associate dean of education and the MedPeds residency associate program director. Sorry, that was a bit of a mouthful there. Thank you all so much for joining us today. I will hand this over to Dr. Owens to share his screen and we can get today started.
Good afternoon, everybody. I'm going to try and not mess this up as I normally do. I'm going to talk about myself after my co-presenters talk about themselves. I'm going to put them on the spot first, and then I will come in and introduce myself. So we will talk with Mary first.
Alrighty, so hi everyone, my name is Daenery Pitani. I am currently a national correspondent with Kaiser Health News. We're a national nonprofit news outlet that covers health and health policy topics. And though the name can be confusing, we do not have any relation to Kaiser Permanente. Just like to put that out there. In the first column, you can see a little bit about the different news organizations that I've worked at previously, sort of spanning digital outlets, traditional newspapers, radio, and some TV. For the past 4 years, I've been focused on health reporting, and 3 of those specifically on mental health and substance use. So covering issues ranging from college mental health, suicide, opioid and stimulant use to disparities for marginalized communities. And it means I essentially read research papers, I talk to people working in the field, I talk to people with lived experiences, and try to share those stories with the public, whether that is feature articles or stories about scientific studies. And my goal in speaking with all of you here today is really just to give you insight into what my job is like and maybe how I interact with sources and sort of demystify the process a little bit. But I do like to be clear that media is a really big word that encompasses a lot of outlets and a lot of reporters, and I can only speak for myself and what my experiences have been. I can't speak for an entire newsroom or for every reporter that's out there. But I have linked to a few journalistic ethics codes here that might be helpful if people are curious, sort of different ethics codes that are widely followed. Those can be helpful. But kind of my biggest takeaway, and I hope if you take nothing else away from today, this is it, that communication is key, like in any relationship. So anytime you're working with any journalist, it's best to just ask any questions you have, because as I've indicated, every reporter, every newsroom is going to handle things a little differently. But hopefully I can give you a sense of kind of how I go about that process and how other reporters might.
Thanks, Daenery. David.
Oh, okay. At least this headshot looks less fuchsia than the first one. Good afternoon, everybody. thank you for joining. And you heard my introduction already. I have a hybrid role. I practice clinical infectious diseases, which is really my passion in medicine, taking care of both adults and children. And I do a lot of medical education across the spectrum of learners, medical students, residents, fellows at Rutgers, New Jersey Medical School. I put in my professional societies there really because that does inform a lot of my opinions. And I'm here as the guy who gets interviewed. And if you can imagine, if you think back, I've been doing this for quite a few years now. So we've gone through not only a COVID pandemic, but flu, Ebola, and so unfortunately, ID keeps popping up in the news. And one of the things that I hope we talk about today is I really had no background and training in doing this before I got thrown into it. Now, I was very lucky that my affiliation with Rutgers, New Jersey Medical School put me in an environment where we had a media relations team that helped me and really helped curate a lot of the questions that I got. And hopefully, if we can share some of those strategies, if you don't have your own media relations team, this is going to help you out.
Thanks, David. I'm now regretting I do not have a media relations team to rely on. Okay, here's a little bit about me. Really today, I'm just the ringleader. I am going to ask lots of questions of David and Daenery so that they can tell us more about these things. I have appeared relatively frequently in the press, less and less so as the pandemic went on, and I will talk about that. You can see what I do. I also have a private practice that I didn't list because it's not really relevant to this. I come to this today more as a consumer rather than a person who is giving interviews, because I am in need of reliable information. And Daenery and I know each other because we met when she was writing at the Philadelphia Inquirer. She interviewed me for a couple of pieces that she did there. I have known David since my freshman year of college, and he and I see things eye to eye. And the one thing that I can say about the pandemic is it's really given me, and I hope he feels the same way, it's given us an opportunity to work together to try and educate the public when information about the pandemic and things is really up in the air and very difficult to communicate. He is the guy that I go to because he's also a pediatrician. I text him rather routinely at 3 o'clock in the morning with questions about my own children. So I trust him. And what I hope to do today is to find a way for us to get people that we trust to be the ones who are giving the information to the public. And I think that is somewhat of a difficult deal to do these days. So let's just talk about it. In terms of the pandemic, the media has a direct effect on our behavior. In the beginning of the pandemic, we talked a lot about social distancing, and people from my business were talking a lot about, we can't call it social distancing because we don't want people to not be social. We want them to be physically distant from one another. And that didn't catch on. We still call it social distancing to this day, despite our best efforts to call it physical distancing as opposed to social distancing. We all know that there are debates about masking. In the beginning, we were told don't mask because then you'll be touching your face too much. And I know that David was involved in a lot of this for NJ.com and other places. Don't mask because then you'll be touching your face. But then we do get mandates that say you should mask, or guidance that said that you should mask. And frankly, the information that we got was all up in the air and quite confusing. Add to that vaccinations. Now we have to deal with actual hard facts as far as science is concerned. And dealing with hard facts when it comes to science, those of you on the call will know that science is not a hard fact kind of thing. We have evidence in one direction versus evidence in another direction. And it takes a lot for the average person to calculate risk. It takes a lot for people to consider what is actually going on when we're talking about putting something into our bodies that may protect us, may not protect us. And when we're thinking about a public that really is black or white in their thinking and 100% versus 0% in their thinking, it's difficult to communicate a message that is digestible by the public. And finally, David and I worked together on a couple of things for ADAA, talking about staying healthy while isolated, including combating anxiety and depression and those things. We have a job not only to talk to the patients who are in front of us or the clients who are in front of us, but we do have a job to communicate scientific information to the public in a way that they can understand. And I'm really hopeful that by the end of today's presentation, we'll be closer to being able to do that. So I don't know who follows the news, but on Friday, there was an FDA panel that decided on whether or not booster shots, specifically the Pfizer shot, was needed. And if you listen to the news that night, depending on who you listen to, you got a different notion of what the outcome was, even though the outcome was the same. If you listen to MSNBC, you had people on MSNBC saying, victory, we have approved vaccines for people who are older and for people who are immunocompromised. So that's what we really needed. If you, however, listen to Fox News, which most people consider on the other end of the spectrum, they said, hey, listen, this is a victory for us because we're not going to be able to mandate vaccines for people who do not want them. This is a smaller portion of the population who will have the vaccines available to them as opposed to mandated. So what we say will be used in the press one way or the other, or in the media one way or the other. My intention today is not to shy you away from getting out there, but actually getting out there in a way that people will listen to you and listen to the words that you say and be able to use it for their health and best interests. I intend today to be a Q&A between the three of us, and for there to be questions that are submitted as we go along. I really do invite active participation. I'm going to talk very little from this point forward and instead pose questions to the other two presenters. And I'm going to start with Daenery, and I'm going to ask her to respond to a couple of them. First of all, what constitutes an expert?
Right. So I usually think about this the way it was taught to me in journalism school in college. So there are different, for any story, there are different buckets in which we might want to speak to people. One is sort of the anecdotal bucket, right? The person with lived experience. For example, maybe it's a person who deals with anxiety or depression. Then my second bucket is kind of my mid-level expert. And these are all just terms we're using as journalists and as I was taught in college, but that's often someone who has some professional expertise. Perhaps they're connected to that person who is my anecdotal lived experience source. So this might be their psychologist or psychiatrist or someone in the same city as them who is practicing in these fields. And then I might have a third bucket, which is a high level expert, which might be basically someone who is knowledgeable on the topic, but is disconnected from that person with lived experience. So this might be the person who can have that, 10,000-foot view on a researcher who looks at this and has done several studies, something like that. So both the mid-level and the high level would be considered experts, but they're kind of serving different purposes in a story.
So if you're trying to establish yourself as that third kind of expert, because I assume you reach out to those people directly, if they're in those first two buckets, as you said, how does a person establish expertise? What do they need to do to attract attention?
So I guess in terms of when I'm looking for sources, right, certainly the credentials in terms of, are you certified doctor, are you certified psychologist, psychiatrist, etc. Do you have those degrees are part of it, but generally, that is the pool in which I'm going to be searching. So within that, sometimes when I was a local reporter, it was a geographic thing, right? If I'm writing for the Philadelphia Inquirer, I probably want an expert who's in this area and can maybe speak to some of the things that I'm going to be writing about there locally. Now, as a national reporter, I have more flexibility and can sort of pull people from all over. One of the things that I think myself and a lot of other reporters talk about is who is able to not only understand the science behind the issues that we're reporting on, but explain them in really simple terms or accessible terms, right? Can they use analogies to help me understand what risk means or what uncertainty is so that I can turn around and then do that for the public? Versus if it's someone who's using terms like, p-values, or if they're talking to me about the specificity versus the sensitivity of a screening test, I might understand that, but I'm then going to have to translate that for the public. And so if someone with the expertise firsthand can help me do that translation, it makes my job a lot easier and makes it more likely that I can accurately translate that information to the public. So that's a big thing. And then some of the smaller things are just have to do with the practicality of the job, right? If someone understands the reality of deadlines and being responsive on email, and of course, everyone is busy, and I don't expect responding to my questions to be an emergency room doctor's first priority. But if I find someone who is able to be communicative with me, that makes my job easier.
I've heard it said that the most important thing is when you receive a request or you see something on Help a Reporter Out or that site, that getting in touch with people quickly, journalists quickly, is very important. That you'd say that's true?
Yeah, I mean, it really depends on like what the deadline is and what you're writing. But, I've been in places where I've reached out to sources because I need to finish and file this story by the afternoon. So that means I'm reaching out to 3 or 4 people at once, and whoever responds first is the person I need to interview, because once I talk to you, then I have to read the paper, talk to you, and then write the story all within a few hours. Now I'm in a place where I have a little more flexibility and I have, longer deadlines. But still, if I don't hear from someone for a few days, I need to reach out to someone else, right? Because I'm dealing with deadlines on my end too. So even responding to say like, I would love to, but sorry, I'm busy at this time, is super helpful.
Cool. Thank you. So as to take some pressure off of Daenery, who's going to get the bulk of the questions today. I have a question for David, because he and I have discussed this previously. How do you select which interviews to take and which to pass on? What are red flags for things that say I'm not going to talk to that journalist or that reporter?
So again, I now have the benefit of an office where, if I get a request from someone that I don't know, I'll forward it over to them and say, can you look at this? But I admit I'll do a lot of Googling, and I, especially when we're talking about things like vaccines and, does this look like it's going to be a setup for a hit, or is this somebody, when you can read their past work, and it's like, oh, they seem to have, an ability to convey nuance and uncertainty. And I think that is something that is one of the hardest parts, especially if you know that your answers are going to be somewhat uncertain. I tend to stay away from things that are hyper partisan or look overtly political, and also because I'm coming with a tagline that says, associate professor of Rutgers. I don't want to jeopardize my institution by all of a sudden winding up on blogs that I have these really controversial opinions that I really don't even have. So there is a certain amount of research into it.
You bring up an important point, and I was joking before, we do have a media relations office on our campus. And it's important that if you are giving interviews, that you make sure that your media relations office is okay with the interviews that you're giving, especially if you aren't going to be cited as a person from that place. I've run afoul of that a couple of times where I forgot to tell someone, and they were not troubled by what I said, but they were troubled that I had not let them know prior to being quoted as that source. So I appreciate that. I'll let you know, in the past few months, I have denied lots of interviews, and basically just for self-care, because I think sometimes we get out there a little too much and we say too many things, and we sometimes contribute to the cacophony and not necessarily to the actual message that we're trying to portray. So we're going to go back to Daenery. I'm going to Make her work a little harder here. This is something that I've always struggled with because of the word expert, and I'm really happy that Daenery talked earlier about what constitutes an expert for her. In psychology, at least, we are told to not call ourselves experts unless we're on the stand, which is not necessarily a comfortable place to be. Otherwise, we're told to not refer to ourselves as experts. And one of the reasons I think that we do that is because there is a lot about the world that we don't know. Even if we have p-values that are below 0.01 or good effect sizes, sometimes the answer is I don't know. And I've felt oddly about saying that. So I'm wondering, is it okay to say I don't know to a reporter in area? Is that going to hurt my chances of being quoted or used as a source?
So it's definitely okay to say I don't know. And I have people say that to me. I think a lot of times when I start interviews, I tell people, right, my job is to ask the questions, and I'm going to ask, as many questions as I have and follow-ups, but that doesn't mean you're obligated to respond to every one of them, right? I would hope you're able to respond to them and we can have a conversation, but just because I ask something doesn't mean you have to deliver a response. And it's also a perfectly reasonable response to say, I don't know. What I find really helpful when people say, I don't know, or we as a scientific community don't know yet, is some explanation of kind of why don't we know? Like, what are the factors making it uncertain, or what are the studies that would answer this question but haven't been done yet? So that way I have a better understanding of, is it you as an individual who just don't know about this, or is it, and I shouldn't, if I look at somewhere else or speak to someone else, maybe I'll find the answer. Or is it like, as a community, we just haven't gotten to that point yet? And it's also helpful if, we can talk about when might we know? And that's not necessarily a timeline, because I know that's hard to predict. But when people say to me, if we did X type of study, or this type of study is already in the works, but data is not going to be released for another 6 months. That's helpful information, and it's helpful for me to convey that to the public too. So totally fine to say I don't know. As much explanation as you can give around that is helpful, because again, I'm coming to you as a quote unquote expert, as we talked about, because from my perspective as a journalist who's writing about all different things, or the perspective of the public, you certainly know more than we do, both about things that are settled and about why things aren't settled.
I love that answer. I'm achieving my goal of learning more today, so that's good.
It is
follow up to
very
that.
Comforting.
I have to tell you, every time I talk to a reporter, I am nervous because I'm afraid that I'm going to say something or come across as not an expert. And I have a natural inclination to want to please people, but also to do my job. And those two things don't always match up. So as a follow-up, if a source wishes to correct themselves, is it okay for them to ask to change or clarify a statement?
So answer this broadly, yes, but some nuance to that is, when you start an interview, it's good to know, first off, is it live or is it recorded? If you're dealing with someone who's writing a print or text story, it's never live, right? Because they're going to have to take your quotes and put it into a story. But if you're dealing with radio or TV, there's a chance it could be a live interview, in which case you can still correct yourself during a live interview, but you often need to do that yourself in the moment as you're speaking. Versus if it's I'm recording something and I'm going to then edit it into a radio story, that means at kind of you have a little more flexibility at any point in the interview to correct yourself, even if it's a few minutes since you said something, but it occurs to you now, you can still bring that up. So that's one thing to keep in mind. And then the other thing that I often find myself having to clarify with researchers or expert sources is, there's a difference between correcting something for accuracy and changing the way something is phrased because you want it to sound differently. And this is where, I often can't, if we did an on-the-record interview, I often cannot change the way someone phrased something just because they wished it sounded better or was less harsh or something like that. However, if there is something they said that they can explain is inaccurate, I certainly want to change that, because I don't want to put inaccurate information out there. So if you're saying to me, I said I don't know, I don't want to pick a controversial topic, but if you said, gummy bears are definitely sweet, but then you come back to me and you're like, well, actually, there's studies that show some are sweet and some are not, and here are links. So I would rather say most gummy bears are likely sweet. But as ridiculous as an example as that is, then I could certainly, adjust that, because you're showing me how the statement was inaccurate and not just something that you wanted to phrase differently.
Great. Gummy bears are sweet. That's good.
Trying to stay away from vaccines and masks, so.
But you make a very important point. Almost everything that you say can be taken in one direction or another. So I want to allay those fears for people, because I've given lots of interviews and I've gotten used to loving that anxiety. But at the same time, everything that you say these days could be taken in one way or another. We're unfortunately living in those times. So I get that. Gummy bears are 100% sweet, by the way. I will just say that.
I will quote you on that.
Okay, another question for David. How have you been successful or unsuccessful with getting the media to relay your message? I don't know if we've actually talked about this, but
I mean, I think probably for all of us, it's mixed. Successful is usually in times of more uncertainty, because I feel like the media are more likely to expand and print what you're saying because there's not a lot out there otherwise. Unsuccessful, sometimes, and I know, Shane, you've had the same things, we've talked about it, you'll talk to somebody for half an hour and it's one sentence, and you just think to yourself, well, that was not remotely the most salient thing I said in the last half hour, but okay. I would like to say, though, I've been fairly lucky, and I think part of this helps. There are a couple of reporters that I've done a lot of work with, and one who I was literally speaking with this morning, and they understand me now. They kind of understand to let me ramble a little bit and figure out what to pull out of the recordings later. And I think that those have been some of the more successful interviews, because they were open to listening and getting the nuance out of it, especially when you're dealing with uncertainty. That has been probably the most successful. But I mean, there's certainly been more than one time where I read something and I say, did I actually say that? Oh, okay, I trust them. I mean, I do trust them, but okay, I wish I had a do-over on that one.
Actually, you caused me to ask Daenery a follow-up question, because you and I both like to talk a lot, and I, as a psychologist, I do talk a lot. Is there such a thing in Daenery as doing too much talking? I know you can only speak for you personally, but in general, should sources talk in briefly, or should they just keep on talking and allow the journalists to select from what they're saying?
I'm going to give the response that many sources give to me. It depends. It depends who you're talking to. That it's really a journalistic style thing. So some reporters, it depends on the story, right? Like, when I generally am someone who prefers when people kind of expand, and if I really need to, I can cut them off. But sometimes they'll say something that I wasn't going to think to ask about that I find interesting. But on the other hand, when I was at those places working breaking news, and I know I have 3 hours for this story, I can't spend an hour on the phone with someone. I need it to go fast. But generally, in that case, I would let people know, or kind of direct the conversation as I can. But it really just depends on the journalist what they prefer.
You also mentioned context, though. Is it okay for a source to ask, do you need this fast, or are you working on something with a deadline, or are you working on something more expansive? Is that okay?
Yeah, I mean, as I said at the beginning, I think communication is the best thing you can do. If you have a question for a reporter, ask them, right? Like, and sometimes I have to be clear with people, there's only so much I can share. A common question I get is, can I see the full article before it publishes? And my answer is always, no, I've never worked at a place where that is allowed. Ethically, we have policies that don't allow that. However, then we can talk about what kind of fact checking do I do and what might that look like. I've had people ask me, how will you describe my title in the article? And I'm happy to discuss those things, right? Pretty much everything I can answer, I will. And if I can't, I can explain, why I'm not allowed to. So certainly ask all the questions you want. It's supposed to be, two-way communication.
I think that that's an important point. I think often it doesn't feel like two ways. I know that I've often felt like I'm supposed to be an expert and only speak to the questions that I'm being asked, but I have a habit of talking a lot, depending on the reporter that I'm talking to. David mentioned he's got a relationship with some reporters. I have a relationship with some reporters as well. And they will call and they'll know that I'm going to talk for a half an hour and will clear a half an hour for me to talk. And sometimes they do come up with maybe 3 words that I said. Other times I end up the real meat of the article. And so it really depends on communication and making sure that you're both on the same page. I appreciate that. The next question is actually a question that David asked. I'm going to let him talk to Daenery about this. I'm interested in hearing this, and then I think it will lead into a story that David and I can tell. So go ahead, David.
Oh yeah, so the basis of this question is, it's a Google Alerts question, right? So all of a sudden you start getting your name is popping up. And then you need Google Translator because it was a Dutch newspaper or something that was quoting you, and I have no idea if that was an accurate quote. So the question is, I know that I did give this interview, and I know that I spoke with someone, and I did say that, but it certainly wasn't in Dutch or Thai or a paper in San Francisco. So how do these things really disseminate like this?
Yeah, there's a few different ways, but it's funny that you mentioned Google Alerts because I actually have that set up for my name too. And sometimes I also find an article where I'm like, I did write this, but I didn't realize it was popping up here. So it happens to all of us. So there's a few different things. If you're interviewing for a place like Kaiser Health News, where I work, or the Associated Press, the AP, some of these outlets work sort of like wire services where a story we write for KHN goes on our website, but our mission is literally that other news outlets can reprint our stories for free and get health policy information to as wide a base as possible. And so that means, by definition, when you speak to me, it's going to show up in other places. And I do try to let a lot of sources know that, but sometimes, people forget. With the Associated Press that, people who pay for their wire service reprint it. So it's going to appear all over the country. So sometimes that's part of the model. Other times this happens because newspapers or other outlets will do what they call aggregation. So maybe they don't have time to do a full news story on their own, but they'll have someone who goes through multiple news outlets and sort of picks out, all these different news outlets reported on, the efficacy of cloth masks. And here are kind of snippets from all of them, and I'm going to summarize this for you. And so they might pull something and generally, it should be attributed from the article that it came from or hyperlinked there. But depending on the news outlet and how they do it, that's another way it might end up in different places. And quite frankly, as I said, a lot of times as a journalist, I don't know, even, as I said, with Kaiser Health News, our stories are reprinted in full by other outlets, but I don't get a list of like X number of places reprinted it. It's only if I happen to come across it or someone tells me that, this other place has it, but I don't know either everywhere that it goes. So just, that's something you can, again, ask reporters, do you know if this is going to go multiple places? But be prepared that, I can't control where it ends up either.
Thanks, Daenery. So this one goes to David. Have your quotes ever been misappropriated? It's a pretty to-the-point question, and I already know the answer. I'm not sure who's going to tell the story, whether it's David or me. I will tell you that it occurred, ironically, David and I had brunch just before the lockdown was called in New York in 2020, and then reconvened in Manhattan after they allowed us to go back in and sit and eat together. We were masked until we sat down, and then we put our masks on when we got back up. But we've had several hours where we commiserated and talked about our various activities. And during this lunch, David got a text that was pretty interesting, or a notification on Facebook, right?
Yeah. Oh, my phone blew up. So this comes from actually a story that I did with a reporter about masking. And we were talking about the different types of masks, and remember that the science was really evolving at this point. And the reporter was talking about layering masks, and putting multiple masks on top of each other. So it was, I really thought it was a pretty, good explanations that I was giving, and the difference between a 3-layer mask and sort of the meshing that would stop the particles, and that a standard surgical mask that I'm, wearing, actually here's mine, right? Like this is 3 layers, and versus wearing multiple masks. And somehow in the course of this, they asked about, well, what about wearing 3 or 4 masks? Which, would be 12, 15 layers. And I said, well, no, I said something like, that's inane. Or like, why would anybody do that? That's just completely stupid. And they said, yeah, that's right. I was thinking too. Moved on. A certain polarizing, shall we say, host from one end of the spectrum that Shane saw picked specifically, that would be, or that is inane, said David Snemo at Rutgers University. And so it's funny because and everybody that knows me would have said, oh yeah, no, I'm sure it was a direct quote. It was just out of context. Because the verbiage was so classically something I would have said. But they didn't use the nuanced clarification that we were talking about, wearing a bandana and a surgical mask and an N95 like all together, and made it intimated that I was just impugning mask wearing in general. And it's amazing how many people from across the country all of a sudden start texting you, like, did you really say this? And Shane could attest that it was like, well, yes, but no. Well, sort of. That's not what I meant. So it wound up being, a big joke at this point, but for a day or two, it was a little uncomfortable.
And I have that habit of speaking off the cuff as well. And one of the reasons why, I'm not usually nervous for presentations like this, but I am nervous for this because I do want to be sort of direct and not as loose with my language and loose with my expertise as I normally am. Speaking to Anery's point about whether you know the reporter or not, I know some journalists who will ask me for clarification if I say something like that and say, are you sure you want to put it that way? Or if you want to be that specific? And not all reporters will, so you do want to be careful, but it's important that you get out there and do it. I can't tell you how important it is that we have more sources for this information.
So along these lines, I'll just actually ask this to Anery, because it literally happened 2 hours ago. I was called, and the question, and I again, this is somebody with whom I've done work before. The question was, when will COVID-19 end? And I said, it's never going to end. And then I said, okay, stop. Let's clarify that. What does end mean for you and your editors? What does, and he was laughing. He was like, don't worry, I know you, I know. And we wound up having, this 15-minute conversation about what scenarios could be an end. But if it's absolutely something that could be a headline, right? COVID-19 is never going to end. And that's, that's fair. I said it, but it was not in that context. So, it actually, even prepping for this, made me think about how to immediately, tamp down and walk that back into something I would be more comfortable getting printed.
All right. That was a fun day. They laughed a lot. All right, final question for Daenery, and she said this earlier, and I'm glad because I thought that this might be a silly question because I think that people think that they know what it is. But I would really like to know the difference between on and off the record and whether that is a hard and fast thing. And so I know you're only speaking for yourself.
Yeah, so I'm going to start this off by explaining what the different terms mean to me. So on the record means that, everything we say, emails and like phone interview, whichever format the interview is taking place in, I can use as a direct quote. I can attribute to you. I can go to my next door neighbor and say, Shane Owens told me this. I can use in whatever way. And generally, when I'm reaching out to an expert source, I'm reaching out for an on the record interview. Most likely, right? I state that I'm a journalist. I state that I'm from this organization, that I'm writing an article about X topic and want to ask you about Y. That request is an on the record interview request when I send it out. Then there are two other categories. There's off the record, but I think people, at least the way I use it, it's not how people normally think of it. On background is more common. So when I ask to speak with people on background, that to me means that I can act on the information they say. Let's say they tell me, there's a lawsuit on this topic in New Jersey courthouse. I can go to the courthouse and ask for that lawsuit, but I will not say that I got it from this person. So I'm using their information, but not their name, or we're going to agree on some sort of descriptor for them, like a psychiatrist from New Jersey, or something like that we will mutually agree upon. But I can still use that information, or if they say, you should talk to X other person, I might go and call that person, even if I don't tell them like, hey, I got your name from Shane. What off the record means to me is that literally you're giving me information that I cannot use. Like I have to act as if I don't know it. And it's literally just for my background. And maybe it gives me an idea of some other place to look, but I can't, really act on it in any way. So typically if I'm having conversations, they are on the record or on background. But the number one takeaway from this is that I want people to have is every reporter defines those terms a little bit differently. On the record is pretty straightforward and it's always going to mean the same thing. But on background and off the record mean different things to different people, mean different things to different newsrooms. So ask. If you are not sure, ask a reporter what that means. And if you don't have that conversation up front, the assumption is typically that it's on the record. So if you want something to be off the record or on background, you need to say that up front generally. Because otherwise the assumption is a conversation you're having with someone who self-identifies as a reporter and lets you know ahead of time that all the information is on the record.
I learned more there, and now I'm thinking very carefully about my upcoming interviews.
But yes, just ask. I was actually interviewing a lawyer last week, and we were going to talk on background. So I, launched into my little spiel about what on background means, and he was like, "You're the first reporter who's explained what that means to them." And so I think it should be done more often, but if it's not, just ask, what does on background mean to you? How will you use this information? Will you let other people know we've had this conversation? I think when people ask me that, it's totally fair game.
I want to say I'm really glad that you joined us today, Daenery, because David and I have talked to numerous reporters, and I don't know anybody who's ever, and it might be the context, no one has ever answered the questions for me the way that you are answering them today, and I don't feel as a person being consulted as a source that I should ask these questions up front. But what you're actually saying is it's okay to ask these questions before the interview starts.
Absolutely. Okay,
that's really important. Good stuff. Okay. I'm going to admit we are out of questions. I learned so much today, and now have to go spend my afternoon thinking about these things when I've got other things to do. I'd like now to open it up to the audience for questions if they have any. Sasha.
Yeah, we are now accepting questions, so if anyone wants to put any in, we are going to review them. Daenery, you've been talking a bit about kind of the questions that are okay to ask, but what are the questions you get most often from those you're interviewing?
Yeah, certainly I think the number one question I get is, can I see the full article before you print it? And as I mentioned before, unfortunately, that answer is normally no from me, just given newsroom ethics policies. Every newsroom that I've worked in has had a policy against that. And the reason we do that is, there needs to be some editorial control over the article. If we start giving it out to people, right, we'd have to show it to politicians we write about before those articles print. We'd have to show it to, people who have been convicted of crimes. Like we'd have to start showing it to everyone. So I have never worked at a place where I do that. However, normally, I understand normally people are asking me that question because they are nervous about how their information is going to be used. So I just try to talk to them about, what I'm hoping to do, the fact that they can, clarify points with me, the fact that and fact-checking processes differ from place to place, but I will often circle back with someone and say, for example, we had this 30-minute or maybe even an hour-long phone conversation. I'm not going to be able to include, honestly, even 50% of that in an article. So I'm going to circle back with you and let you know, like, from the hour or 30 minutes that we spoke, what are the topics that I'm actually going to include? And that's not to say, like, now you can go ahead and change that, but I think letting people know gives them more comfort in speaking with me and makes them gives them an opportunity to know before it's out there. And if for some reason I have misconstrued something, when I send them an email that says, hey, I'm going to include the fact that you said gummy bears are always sweet, and they're like, oh wait, no, like you didn't this context, or you're missing this. We have an opportunity to have that conversation before the article publishes, even if they can't see the article in full.
Nice, thank you. We do have a question that came in, and I'm going to open this up to anyone. What advice would you have for television interviews, live or recorded?
Oh, that's a hard one. I will say to the men in the audience, you must embrace makeup. Honestly, I did one television interview and I sent it to my mother, and my mother said, you looked great and you sounded great, but your face was so red. And it really is. Next week when I talk with psychologists about this, I'm thinking about not including the interview because my face was really red, and appearance does matter as far as television is concerned. Daenery made an important point earlier about whether it's a live or a taped interview. I will tell you, I am too anxious at this point to do live interviews because a lot of the questions that I get are the kinds of questions that David was talking about earlier. Not necessarily gotcha questions, but the questions that I have to answer have more thought and meat to them than just being able to do a 2-minute interview and give anything that's important. I'll leave it to everybody else about that because I have relatively little experience with television.
I mean, I've actually never done TV for that being the main reason, but then also the offers I've received were, live for 3 minutes between 10 and 10:30 a.m. and I'm like, I got a job. I can't. I'm sorry. And I'm not going to tell my job that I'm leaving to go to your studio to sit there for 2 hours. So it's just never been conducive for me. But I think probably because the way my brain works, I'm most comfortable, and I'm curious what Daenery would actually even think about this. I'm more comfortable sitting there, literally sitting on my couch last night watching football and typing answers to questions to a reporter that just, asked, here are 3, brainstorm about flu this year and answer these 3 questions to me. And I think I probably torture them because all of a sudden, I'll start putting in links. If you want more information, check out this. And oh, actually the Australian flu data published last week. Here's the link to that if you're interested. And I don't think they use most of it, but I'm much more comfortable in a format like that than I would be on the Today Show.
So let me address that in a second, but first, in terms of the TV interviews. So TV is the medium where I've spent the least amount of time. I've mostly been a print or radio reporter, but I will say a few things. In TV and in radio, 3 to 4 minutes is a lifetime. I'm gonna be quite honest. I've been like, when I'm filing a typical story for radio, it's 30 seconds or a minute and a half. So as short as it seems to like the normal person, those are actually long stories in the broadcast world. What that means is kind of, when I've been interviewed on radio or TV, like I try to think about what are 2, maybe 3 main points I'd like to come across from what I'm saying. And so then, whenever I'm asked a question, I kind of funnel it through, can I use one of the main points to answer this question? But it's just, it is quite frankly, that medium is limited to a certain amount of time. And so it's also just, it's a skill that the more you practice talking on live radio or live TV or just even doing recorded interviews and saying things in a short amount of time, I think the easier it becomes. To David's point about the emails. So I think this is, again, varies by a little bit by journalist to journalist, but often journalists prefer phone interviews or in-person interviews over emails because emails often, people tend to write like they write in academic journals. And so I'm getting a lot of good information from you, but I've also probably, or not probably, but in my case, I've often read a journal article that's conveying that information. I want to talk to you to get that human element, to get it in a way that I can quote it. Quoting from emails tends to be very not conversational and difficult for, conveying it to an average person. And I also want that like in real-time interaction so that if I'm confused, I can ask you to clarify it right then. Or if I repeat something back to you and you realize that I've misunderstood it, you can clarify yourself right then. So I think that's another question I frequently get from people, like, hey, can you just email me the questions and I'll write in the answers? But I generally will try to push for a phone interview because I think it benefits both people to do it that way and have that real-time interaction.
Thank you. Those are all the questions that we have for today. I would like to quickly share my screen and just take a moment to invite everyone to our upcoming webinars at ADAA. Next week, we'll have Dr. Owens here again today for psychologists in the media. So another great panel opportunity to discuss further kind of the intersection between mental health in the media. And then we have our upcoming fall forum, Depression Across the Lifespan, coming up on Thursday, October 21st. And if you're not yet an ADAA member, we invite you to join. You get year-long access to CE webinars and many additional benefits. If you have any questions, please feel free to email me at sicard@adaa.org. And I would like to thank our presenters for being here today. Daenery, Dr. Cinema, Dr. Owens, this is a wonderful presentation, and to all of our attendees, thank you so much for joining us today. If you have any additional questions, please email webinars@adaa.org, and hopefully we'll see you next week. Thanks so much.